You're listening to the Biohackers World Podcast.
Hello, I am Dr. Jason Pencek. I'm here today at the Biohackers World Conference in Chicago, Illinois. I am a nurse practitioner and chiropractor and have a longevity clinic in the Chicago area. I'm here with Dr. Nathan Bryan today. He's been working with nitric oxide for the last 25 years in different companies that he's owned, and basically you've been the CEO, chairman, owner of Bryan Therapeutics for the last how many years?
Yeah, Bryan Therapeutics we started several years ago during COVID.
Got it. And so he's here to join us today and talk about some nitric oxide and why it's useful, and we'll just kind of have a chat about this.
Awesome. Look
Thank
forward
you for
to
joining in. I appreciate
it. Thank you,
So Nathan, you've been working with nitric oxide for 25 years. What first drew you to this molecule? What got you excited about nitric oxide?
Well, I graduated from University of Texas with a degree in biochemistry, and I was entering, I went to LSU School of Medicine, and I was working on a PhD in molecular and cellular physiology, and the Nobel Prize had just been awarded for the discovery of nitric oxide. Okay. So it was an emerging science. Yeah. I had a chance to meet the guys who won the Nobel Prize, and it was a fascinating molecule. And they even 26 years ago, they said, look, if you can figure out how to safely and effectively deliver nitric oxide, it'll change the world. So I was like, well, that's a pretty profound statement. So that's what I've been doing ever since.
So can you tell me what are some of the things nitric oxide works on? I think this is what everyone wants to know. Yeah. What is it that does it?
Well, it's what we call a signaling molecule. In fact, the Nobel Prize was awarded for the discovery of nitric oxide as a signaling molecule in the cardiovascular system. So it's first recognized as a vasodilator, right? So it dilates the blood vessels, improves tissue oxygenation, blood flow. So that was its primary kind of how it was first discovered and its importance. But today we know that it mitigates inflammation, it mobilizes stem cells, it improves mitochondrial function, it prevents our telomeres from getting shorter. So it's a foundational molecule in longevity and health and wellness. In fact, every major chronic disease, the earliest event in the onset and progression is always the loss of nitric oxide production. So there's many things that lead to that loss, but it's certainly the loss of nitric oxide production that leads to the rapid onset and progression of disease.
Is there a certain patient population, say these people for sure, nitric oxide automatically yes, or is this like every single person? This would be a good thing.
Well, there's really only two people in the world who need nitric oxide. Okay. And the first are the people who are sick and want to get well, and the other is people who are well and don't want to get sick. Okay. So if you fall within one of those two, then I think nitric oxide is absolutely foundational. Okay. And so it's, obviously people who are sick and tired of being sick where conventional medicine has failed, I think we're finding, I've seen, people get better with nitric oxide. Yeah. Because it restores blood flow, it reduces inflammation, it inhibits oxidative stress, and it corrects the immune dysfunction that we see in chronically ill patients. And then for people like you and I who are health conscious, healthy, and don't want to get sick, we need that nitric oxide, and we need to prevent that age-related loss that we see.
So when you're using nitric oxide in patients, is there a dose specific? Like every patient gets the same dose, or do you change that based on what is going on with the different people?
Yeah, no, look, there is no one size fits all, right? Everybody's different. I think so what we're finding based on the science is for prophylactic, like people who take it proactively to prevent that, then usually one lozenge, we make an orally disintegrating tablet. One in the morning, one in the afternoon, 12 hours apart, because we understand the pharmacokinetics, we understand the pharmacodynamics to maintain optimal nitric oxide levels. But for a diabetic patient, for example, an Alzheimer's patient, for example, the needs for nitric oxide in those patients is much different than you and I being proactive and prophylactic. Yeah. So that's what we're trying to do now with our drug therapy. We've got drugs we're developing for Alzheimer's, ischemic heart disease. We make a topical drug for diabetic ulcers. But really dialing in the level of nitric oxide and the dosing regimen for that specific indication.
So for a practitioner like me and lots of the people that watch, what would you tell them how easy it is to implement this into their practice? Like in just step one, just buy obviously some nitric oxide lozenges and just start using them? Or are you giving dosing protocols and everything when you work with the practitioners?
Well, we start, obviously we do training and education to the practitioners because, and then once the practitioner has an understanding of nitric oxide, how our technology works, then we leave it to their best medical judgment for that patient to dose according. So everybody, one lozenge twice a day. But if you've got a resistant, hypertensive, metabolic patient, that person may need one lozenge every 4 hours, every 6 hours. And, for blood pressure, it's easy to titrate that in because you can measure your blood pressure, you can dose, 3 to 4 hours later, 6, 7 hours later, if your blood pressure starts to go up, then we dose according to that. But this is meant as a supplemental restorative nitric oxide based therapy. So these are what we sell today at dietary supplements, obviously not intended to treat, cure, prevent disease. But with our drug therapy, that's again what we're trying to do, titrate in the right dose in the right patient for the right indication.
Awesome. Is there any labs that we can look at and say, hey, this person's in a disease state now, we need to, like, obviously CRP goes up, we see inflammation, automatically, hey, we should move your dosage up? Are you discussing that with clinicians, or just even your patients coming in that have lab work, maybe aren't working with a practitioner?
Sure.
Are you using this data at all to drive care?
The challenge is there's no labs for nitric oxide. Nitric oxide is a gas, and once it's produced, it's gone in less than a second. In the research lab, we measure metabolites and markers of nitric oxide, but clinically it's not used. But what we're finding is, things like an elevation in C-reactive protein, which is acute phase marker of inflammation. Ferritin, again, inflammatory marker. Then we start to titrate in doses. In fact, one of my patents is on a method of reducing inflammation, C-reactive protein. We usually see about a 37% reduction within 30 days using our lozenge.
Wow.
And then triglycerides, an elevation in triglycerides. Again, I've got patents for normalizing triglycerides. If you got a patient with triglycerides greater than 150, we find that if you use one lozenge twice a day, within 30 days, we've reduced that by about 27%.
That's super cool. So, this is obviously your work for the last 25 years. Do you have any really interesting stories with, like, Alzheimer's is something you work with, and heart disease? Have you seen any really impressive things happen with taking the lozenges?
Yeah, the one I always refer to, well, there's two. One is my dad, who was my first kind of guinea pig with nitric oxide. My dad's a paraplegic, had a car accident in 1984. So for 40-something years, he's rolled around in a wheelchair, was hypertensive, diabetic, complete metabolic disease. Standard of care failed him. So I started giving him the lozenge. We normalized his blood pressure. We got him off blood pressure medicine. We normalized his diabetes. In a sedentary older guy, to see the effects of that lozenge on him, I thought, wow, if it does that to a paraplegic, a 60-something-year-old paraplegic, we can really make an impact in the world in general. But then the other one I show is a pediatric patient. We were treating a 15-year-old pediatric patient at Texas Children's Hospital in Houston with a very rare genetic disorder. He had what's called arginous succinic aciduria. It's a very rare inborn error metabolism. And for 10 years, he had uncontrolled hypertension, severe heart disease, left ventricular hypertrophy, uncontrolled resistant hypertension. He had kidney disease. He had liver disease. And there was no medication that would normalize this kid's blood pressure. In fact, when we saw him in the intensive care unit, his blood pressure was 210/115. And really, the docs were out of medication. There was nothing that would normalize his blood pressure. And so we just started dosing him with my nitric oxide releasing lozenge, because we'd published a year before that it was many of the collateral symptoms that couldn't be explained by the genetic disorder were due to nitric oxide deficiency. So the thought process, and I was in the room with a pediatric cardiologist, nephrologist, his geneticist, his just primary care doc. And this was an experiment, right? We dosed him the lozenge, which generates nitric oxide gas. Within 4 hours, his blood pressure was 130/80. We monitored him for 12 hours, completely safe. We released him from the hospital. He went home. We was taking it. Within 5 days, we reversed his kidney disease. Within 5 months, we reversed his heart disease.
Oh my God.
We got him off all prescription medication. His cognition improved. And we published this in the American Journal of Human Genetics in 2011. But we completely saved this kid's life with a very rare genetic disorder simply by giving our nitric oxide lozenge.
Wow.
That's been the most transformative case study we've done. In fact, it was on worldwide news. We were on there. They did a documentary on us on PBS, and because we saved this kid's life with nitric oxide.
That is super amazing. In my practice, we use peptides, hormones, GLP-1s. Where do we see this fitting in on that? Is it going to accentuate all these treatments I'm doing already? Obviously the GLP-1s work really well for reduced inflammation.
Sure.
And then obviously nitric oxide can reduce that even further. And the biggest thing we see obviously right now in the population in America, overweight, metabolic instability, and I feel like nitric oxide potentially could fit in this kind of population.
For sure. No, I think what we're finding is it's foundational.
Yeah.
It's not a panacea, it's not a silver bullet. But certainly it's going to accentuate every other therapeutic therapy that you're using.
Yeah.
So in metabolic syndrome, right, it's going to normalize the blood pressure, it's going to reduce triglycerides, and it's going to improve glucose uptake and fasting insulin glucose levels. So when you combine that with other therapies, whether it's, the GLP-1 agonists, obviously are very important drugs. And what we're finding is nitric oxide can mitigate the side effects of the GLP-1. So the gastroparesis.
Okay.
Right? So if you give nitric oxide, you improve gut motility and you overcome the gastroparesis that a lot of patients suffer with the GLP-1 agonist. And whether it's peptide therapy, because if you're the analogy I use, the metaphor is if we're going to order something from Amazon, and it's on the Amazon delivery truck, and there's a traffic jam, you're not going to deliver that cargo, right? And that's what happens in people with vascular disease. There's traffic jam. There's not enough blood supply getting through these blood vessels. So if we give nitric oxide, we're going to dilate the blood vessels. We're going to clear that traffic jam. Now we're going to get a better delivery of that cargo, whether it's peptides, GLP-1 agonists, whether it's basic nutrients, magnesium, iron, calcium. If you can't get the nutrients and the therapies to the diseased tissue, then they're going to have limited therapeutic benefit. And so every chronic disease, whether you're treating heart disease, liver disease, pulmonary disease, there's always reduced blood supply. So if we treat with nitric oxide, we're going to open up the blood vessels. Now we're going to get better delivery of the therapeutic agent to the site in which it needs to have its effect.
I love all that. Now, kind of switching gears, I'm just curious. I use a lot of tadalafil in practice, which is a PDE5 inhibitor, and keeps cyclic GMP, which is nitric oxide. Is it something we could pair with tadalafil, or some kind of, if patients are on, Viagra and they're on Cialis, they're already taking the stuff, can you give this to them safely without worrying about, some kind of issue with having too much nitric oxide?
For sure. So look, these drugs I think have played out. There's low-dose Cialis has been shown to, prevent Alzheimer's.
Yeah.
People recovered from COVID, resistant to COVID infection. So I think it's certainly a longevity molecule, but when we have to understand how these drugs work, and you alluded to it. So nitric oxide activates an enzyme called guanylyl cyclase, leads to cyclic GMP, and then the PDE5 inhibitors prevent the breakdown of cyclic GMP. So then that leads to smooth muscle relaxation and vasodilation. But here's what we know. Those drugs were approved in 1998. They've been on the market now for 26 years. And 50% of the men that are prescribed, either whether it's tadalafil or sildenafil or the other PDE5 inhibitors, don't respond with better erections, or their symptoms of BPH don't improve. And what we're finding is they don't respond because they're not making enough nitric oxide to activate that second messenger system. So now if we give the lozenge or we give nitric oxide, we increase cyclic GMP. These non-responders are now responsive to PDE5 inhibition therapy. And I think most importantly, you can lower the dose. Certainly the 5 milligram daily tadalafil is very effective. But you can make it much more effective, get better erections, get better urinary symptoms of BPH if you pair that with the nitric oxide lozenge. But to answer your question, what do we worry about? We worry about an unsafe drop in blood pressure, and we worry about methemoglobinemia. Those are the only signs of toxicity.
Okay.
So certainly we don't see an unsafe drop in blood pressure with a 5 milligram tadalafil.
Yeah.
We hardly ever see any met formation. In fact, in that kid, we were treating him once every 4 hours. We were measuring his blood for methemoglobin. We were measuring, obviously, his blood pressure. There was never an unsafe drop in blood pressure, and there was never any increase in methemoglobin levels.
What's the max dose you'd be giving a patient? Like when you're talking about someone who's really sick, the kid obviously was every 4 hours. But if it was an adult with a similar situation, would you increase that to every 2 hours? How often would you be saying is the max you should be doing?
Well, I base all the discussions based on what we know and what we published in the literature. So the once every 4 hours in a 15-year-old kid that weighed about 155 pounds, we know is completely safe.
Yeah.
We don't have any clinical data to indicate that taking it every 2 hours would lead to that same safety profile. I can't speak to the safety of it because we had a drug in phase 3 clinical trials for COVID, which was a higher dose, a drug dose compared to the supplement dose. And we were treating really sick COVID patients once every 12 hours with a much higher dose. And even in those patients, some were on 20 different prescription medications.
Wow.
There was no safety signal. We treated over 600 really sick patients. There was no safety signal in first dose effects. There was no safety signal in unsafe drop in blood pressure. No interactions with any of the current medications they were on. So I'm absolutely convinced the way we deliver nitric oxide at the doses we're delivering both as a supplement and as a drug therapy in our clinical trials is completely safe. And that's very important because the number 3 killer of men and women around the world is drug therapy.
Yeah.
So first, do no harm. Develop safe therapies and then titrate in a dose that's effective for whatever indication you're going after. And that's our metric, that's our beacon of hope. And we're a drug company, we're a biotechnology company, but we don't employ pharmacology. We don't make synthetic compounds that inhibit biochemical reactions for drugs. We operate on the principles of restorative physiology. Give the body what it needs, the body heals itself.
So you mentioned nitric oxide is such a short seconds. What is it that makes your lozenge last for 4 hours, right? Because, I mean, if it lasts for seconds, you give that and within seconds, it should be all
No, that's right.
Yeah.
That's right. Well, first, we had to understand, and this goes back 25 years ago when I first started in the field, because we had to understand, once nitric oxide is produced, but then it's gone in less than a second, where does it go, what does it become, and how does it signal?
Correct.
And so really for the first 3 to 4 years of my career, I create a fingerprint of endobiology. When nitric oxide is produced, it binds to metals, activates second messenger systems. It binds to cysteine residues on proteins, affects protein structure and function. It binds to glutathione, the cysteine residue of glutathione. It's oxidized to nitrite, to nitrate, and all these other secondary systems. So then we created a fingerprint, and under optimal conditions, and we're having adequate nitric oxide production, we create this fingerprint of endobiology, and now to develop therapies, we want to recapitulate that. So when we produce nitric oxide, we control and dictate the metabolic fate of that nitric oxide that we're producing. We don't want any unwanted chemistry and nitrosative chemistry and all that, but we want to recapitulate nitric oxide production and recapitulate nitric oxide signaling. So that's what makes our technology different. We make nitric oxide, we control and dictate the metabolic fate, we get beautiful pharmacokinetics, beautiful pharmacodynamics, and we overcome nitric oxide deficiency and allow the body to do what it's designed to do.
That is absolutely incredible. In the last 5 years, is there anything new about nitric oxide that's come out that you've been like, this is wow, I can't wait to tell people about that? Or anything new? I mean, you've been 25 years doing this. There must be some new stuff that's come out, right?
Oh, look, that's what wakes me up in the morning with a smile on my face is the future. We've had an orally disintegrating tablet on the market for a number of years.
Yeah.
We created a fermented beet powder because most beets were a hemo-vegetable dating back to the 2012 Olympic Games.
Yeah.
But unfortunately, most beet products on the market provide no nitric oxide benefit.
Okay.
They're what we call dead beets. They're dead beet. The only thing they do is turn your pee and your poop pink, cause a lot of anxiety. But there's no nitric oxide. So we felt an obligation to create a beet product that produced nitric oxide. We call that NO beets. We ferment the beets, we take out the oxalates, and it produces nitric oxide when it's put in solution. And then we developed a topical nitric oxide for skin care.
Okay.
Because the skin is an organ. If you don't have adequate blood supply to the skin, you get fine lines and wrinkles and you look old. So we make a topical. And then, I developed a couple of months ago a toothpaste because we're finding how important the oral microbiome is for nitric oxide 100%. Production. So we remove fluoride. It's a hydroxyapatite-based toothpaste that remineralizes the teeth. We target the microbiome. We improve the diversity of the microbiome. We improve nitric oxide production. And we've got an incredible oral care line of products. We're developing a nitric oxide-friendly mouth rinse. 2 out of 3 Americans use mouthwash every day, kill the microbiome and cause nitric oxide deficiency. Now we're using that as a target. And we're finding that if we have people that have high blood pressure and they switch to our toothpaste, we normalize their blood pressure.
Just the toothpaste?
Just the toothpaste, because we're targeting the primary source of the dysbiosis that's causing hypertension. And then, we've got drugs now for ischemic heart disease. We've got a drug for Alzheimer's that we're moving through the FDA, and we're taking our topical drug and developing it for diabetic ulcers and non-healing wounds. And I think it's going to change the world. It's going to change the landscape of medicine. Because our nitric oxide drug therapy gets to the root cause of dementia and Alzheimer's.
Yeah.
It's a vascular disease. It's a metabolic disease that leads to protein misfolding.
Yeah.
If we restore blood flow to the brain, overcome the focal ischemia, we improve glucose uptake, improve insulin signaling. The brain functions. You don't get protein misfolding. You don't get amyloid plaque. You don't get tau tangle. So nitric oxide will cure and will prevent Alzheimer's disease. And we've seen it, and we're working on that as a drug therapy now. And the other thing I'm excited about, because again, it goes. My dad, being a paraplegic, had decubitus ulcers that he almost died from, got septic and infected wounds, and 4 years of non-healing wounds. We healed it with a topical nitric oxide. And 65,000 Americans die in nursing homes every year from infected wounds.
That is.
And now we have a solution for that we haven't seen a wound that nitric oxide hasn't been able to heal.
That is beyond impressive. When I first started practice, one of the first books I read was about nitric oxide. 8, 9 years ago, I was in school. I'm like, I knew nitric oxide was a huge thing, but back at the time, the products that were out, a lot of them beets, right? That's the thing. Everyone, pushes beet powder. That's the thing. And I'm like, it's not really making much difference. I used it in patients, and they saw no difference. And as you're saying here, it's because the beets that we were used were dead. There's no use to it. So I guess, what is one clinical myth that you hear about that you're like, I wish that would just stop? Like, why do they keep saying this about nitric oxide? Like, again, some of the products don't work. I think that's probably the part of the problem is people say, how do I even treat this?
The source of my daily frustration is differentiating what I do from all these other companies out there, because there's hundreds of so-called nitric oxide products out there. You see it on TV, the beets, take this. But the problem is they don't work. And the challenge is, until you spent 25 or 30 years in the research lab understanding the enzymology, the biochemistry, how the human body makes nitric oxide, what goes wrong in people that can't make it, you can't even think about or even contemplating making a product if you don't understand the science. So there's no other company out there. Companies run by tech CEOs, from insurance salesmen.
Yeah.
And they think they can make nitric oxide in a science that's 40 years old, that the top pharmaceutical companies, the brightest minds in the world, haven't been able to do.
Yeah.
So I have to differentiate what I do. Yeah. I'm a scientist by trade, I'm a CEO and founder, and I will never abdicate that role to anybody who doesn't understand the science. So we're driven by the science, not by profits.
I love that. Well, Dr. Nathan Bryan, thank you so much for coming and joining me today. Really excited. People check out your company, Bryan Therapeutics, get some nitric oxide lozenges, and start living a better life.
Thank you, Jason. Appreciate you.
Come join us at Biohacker Miami, November 1st and 2nd.